Hello, Star Trackers, and welcome to this tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. We're helping El Paso help their pets. So today I want to talk about hyperthyroidism in cats. So hyper means increased, and thyroid obviously is our thyroid glands. So hyperthyroidism is very common in cats. We don't typically see it in many of the other species, but it is one of the main hormone-based diseases that we see in cats. And it's important to know about it and to watch for the symptoms because sometimes those symptoms can also be seen with other diseases such as diabetes and kidney disease, which are also somewhat common in cats as well. So basically hyperthyroidism tends to happen, like I said, just in cats for the most part. Also tends to happen in middle to older age. And the symptoms that you'll see, or first of all, it's caused by either a little growth or a benign tumor on the thyroid gland. So it causes that thyroid gland to overproduce the thyroid hormone. Thyroid hormone is related to metabolic system, so it increases the metabolism of the pet. And so the symptoms that you'll see are weight loss, increased hunger, so they may be eating a lot more, but they're still losing weight. Sometimes they'll urinate and drink more as well. And sometimes their behavior can change. They may act restless or antsy. They may vocalize more. Occasionally they'll become aggressive. And that's all kind of that anxiety from that increased metabolism. Some pets will also vomit more. About 50% of cats with hyperthyroidism will vomit, and that's from usually them eating too fast. So they actually vomit up only partially digested food because they're just eating too fast. Some will also have some diarrhea because the intestinal tract is moving along faster. And so obviously all those symptoms are kind of not really very specific because they can happen with, intestinal issues and GI issues and kidney issues and diabetes and things like that. So it's just important to watch out for. Some cats actually don't even have very many symptoms. They may act pretty normal and just be a little bit on the thinner side. But we should be testing our pets, so dogs, cats, exotics. Every year they should be getting some blood work, especially as they reach their middle to senior years. So we typically consider at about 6 years old or above, we want to be getting annual blood work for them. It's just like us when we get older, blood work is really important so that we can figure things out quicker, and know before they become a huge problem. And if we think about it, doing blood work once a year in our pets is basically like doing blood work every 7 to 10 years in us. So it is really important. And if we can catch issues before they become a huge problem, then we can manage them a lot better. So if you are in the El Paso area, our clinic does monthly promotions just to make it easier, and we follow the national kind of pet awareness months, and so this month is senior month, and so we have discounts on our senior blood work. So I encourage all of you to bring your pets in and get their senior blood work done. But anyways, if your cat does come up with hyperthyroidism, and really the only way we know, there's some things on physical exam that we can tell, like some cats will have a increased heart rate or even a murmur because of the thyroidism. Some will have a little what we call blip, so a little enlarged thyroid gland that we can palpate. But some won't have any, and then obviously the symptoms I already talked to you. But the only way we find it is on blood work. And so we do a full panel, make sure there's nothing else going on like diabetes or kidney problems. And it also has the thyroid level on it. And so if that thyroid level is really high, then we know, as long as all the other things kind of coincide with it, that your pet has hyperthyroidism. There are several different treatments for this, ranging as mild to just a special prescription diet. that can help with that. And so that's another reason for checking annually and catching this early if it does happen, because maybe you can go without medications. Maybe you just put them on a diet and you monitor, and that may be enough. The next level up, in addition to the food, is to put them on a medication called methimazole. It can be a pill or a transdermal, meaning you rub it on the flap of the cat's ear, and it transmits through the skin, and they get the medication that way. And then in some severe cases, they actually have to go through an iodine radiation, and this is done at specialty clinics. So if you have your pet with any symptoms like that, or you know anybody that does, make sure you get them in and get them tested. If you have any questions, let us know. I hope everybody has a great day. Bye-bye.